Greetings of the day. My name is Lekha Ramyaa and I am working as an assistant professor from the Department of Psychology at Kristu Jayanti College Autonomous. So today we're going to look into a very interesting topic from abnormal psychology, and that is generalized anxiety disorder. I'm sure this term is very familiar and all of us have heard about anxiety, and we talk about it so much in a day that sometimes we don't understand how serious it could get if it is to be a mental health disorder. Let us now unlearn and learn new things about anxiety in generalized anxiety disorder. First up, to understand what is generalized anxiety disorder, we have to look into the DSM-5 criteria for the same. What is DSM-5 criteria? So in order to diagnose generalized anxiety disorder, which is also known as GAD, it is important for us to understand what could be the probable symptoms, the duration, and when does this affect an individual. So let us quickly dive into the criteria. The first point tells us that an excessive anxiety and worry, if this is observed for a period of at least 6 months, then it could probably be some point of concern for people to look into it. Okay, so it should be occurring almost every day for at least a period of 6 months and under a lot of different circumstances or activities. What could be the other symptoms? Now that is explained by point B and C. So point B tells us that the person finds it very difficult to control the worry. So if they try as much as possible to do so many other activities and try to understand if they can control the worry, the anxiety that they feel within, it's fine. But things go out of control when they are not able to control that worry. That is another point of concern which differentiates it from normal anxiety and generalized anxiety disorder. The next point is going to tell us if an individual has 3 or more of the following symptoms, then it is of immediate concern that we have to take this person for further professional mental health. Okay, so let's see what are the points. Now the first one says restlessness or feeling of keyed up or on edge. So certain individuals, if they are almost throughout the day feeling excessively restless for a period of 6 months, this is a very good symptom which can help us identify GAD. Being easily fatigued is another point. This can be a common symptom which is seen even in depression. But when it comes with a combination of other symptoms, then it is easier for us to differentiate and identify GAD from any other mental health disorder. Difficulty concentrating. Okay, so this also is an indication. So sometimes when individuals say their mind goes blank quite often, then it's again a serious concern. If it is seen maybe once or twice within a period of a year or 2 years, that's absolutely normal. But if it is constantly seen on a daily basis for at least a period of 6 months, then it is definitely something that we need to look into. The other symptoms also include irritability, muscle tension. So these are some of the physical symptoms that you can observe, and the person who is undergoing it would also be able to tell you that they are quite irritable with anything that happens to them. It can be a very silly thing. Probably they need not have reacted so much to it, but because of the kind of difficulty they have within themselves, this could be possible for an individual who has GAD. And also muscle tension is something again which really needs to be looked into if it's just not a normal physical symptom. All right. And we also have sleep disturbance. So usually most of the mental health disorders, you can see there is definitely some kind of a disturbance in the eating patterns as well as the sleep patterns or the sleep cycle. If any of this gets disrupted to an excessive amount, then it is surely a point of concern. Up next, we see point D, which is giving us some idea about the differential diagnosis. What is differential diagnosis? So, we are able to say that this is GAD because of these symptoms. But at the same time, as a clinician, it is important for us to remove other disorders which are not exactly indicative of GAD. So, what other disorders are different from GAD? To have a look at that, I would like you to look into the points that are highlighted, which tells us what are the different disorders which may not be the same as GAD, but symptoms could be very similar. For example, you have panic attack, you have obsessive compulsive disorder, and so many other disorders are mentioned there. Even a separation anxiety disorder or hypochondriasis could be all under the spectrum of anxiety disorders, but GAD is a specific disorder in itself which has its symptoms quite unique. Please also note that some of these disorders could also be comorbid or could coexist with the already existing mental health condition. We'll quickly look into that as well. Let's move on from here now. All right. So, two other important points that comes as part of most of the DSM-5 criteria, but you need to quite note this down that it's very important that you have to understand why this is quite commonly seen. So, the anxiety, worry or physical symptoms cause clinically significant distress, okay? And it does not allow an individual to perform to their maximum in the social, occupation or any other important areas of functioning. So, these individuals will not be able to give their 100% into anything as any part of their life. So, even at home, they might be feeling extremely fatigued, tired, not going to talk to people or being very extremely irritable. Even at the workplace, this is observed. So, in more than one setting, you can observe these symptoms that's inhibiting them from performing their maximum. The next point tells us that it is definitely not attributable, which means substance effect, okay, is not the reason for such symptoms. We definitely know that taking up substance can cause a lot of difficulties in individuals. But even without the effect of a substance or substance use or substance abuse, these individuals definitely have at least two or more of the symptoms that we have seen according to the DSM-5 criteria. So, here is a quick picture for you to understand and grasp what are the different symptoms in a nutshell. I want you to take a good look at it and please understand how it can manifest for us to identify at a preliminary level at our households and definitely take them for further help to the mental health professionals. Moving on, etiology. Now, what is etiology? Etiology talks about what are the causes of generalized anxiety disorder. Okay, so GAD could occur due to many causes, okay, and there's a lot of research study going in to this because we still haven't been able to find exactly a precise reason as to why this is happening. But let's look at the different causes that has been scientifically looked into and proven to have caused GAD in individuals. Okay, so the first one is brain chemistry and functioning. It's important for us to understand that anxiety stems from the brain, correct? So it's a function of your brain. And imagine if there is some kind of a damage caused in your brain within the lobes or in some area of your brain, or if there are different neurotransmitters which are not equally working in terms of their levels, that can definitely affect the level at which you can react to certain things in life. And also remember, all your emotional reactions are connected to the limbic system, correct? So, limbic system is part of your brain that controls your emotional reactivity. If there's some kind of an issue there, then definitely it can manifest as generalized anxiety disorder. Genetics, popularly known in most of the mental health conditions. So, in most of the first degree relatives, if this was existent, then there are high chances that the offsprings can definitely develop GAD at some point in life. Not that it is compulsorily that they have to develop, but then there are high chances and they are at high risk. And the next point is differences in the way threats are perceived. So not all of us are scared, or not all of us are anxious about certain situations in life. So let's say if I have to put you in front of a stage and talk to 100 people in front of you, what do? There are some individuals who take it up in their stride and perform the best or talk the best. But not everyone has that, right? So many people also tend to develop anxiety and fear. So that can be a stimulus but perceived in a different way. So if you perceive it as a threat, if you perceive the situation as something that you don't want to be in or you want to avoid immediately, that could also develop GAD. So this is an environmental factor, environmental cause for generalized anxiety disorder. Of course, development and personality, partly your biological predisposition and partly the way you have been raised, the kind of environment you have been in, the kind of peers that you've been accustomed to, all of this kind of shapes your personality, and that is also a reason for GAD. As we move on, let's look into what are the risk factors. It's important for you to not only understand the causes, but also what could be the risk factors which are involved. Okay, so here comes a stunning fact. Women are mostly diagnosed with GAD as compared to men. Why does this happen? I want you to go back and do some research on this and understand why this could be a probable reason. And this point is definitely not just stated without any facts. It is a factual information and you should be definitely eager to know what it is. So go back and look into it. So that comes as a factor of risk. Not that all the women are going to develop GAD, but women are mostly diagnosed more in number. Then comes your personality. So if you have a temperament which is very timid or negative, so if you're a person who's most of the time pessimistic, or you are afraid of getting into new experiences, meeting new people, getting into new things, then that could definitely be a risk factor for you to develop generalized anxiety disorder. Genetics again, so I'm not highlighting this point because we just looked at it as one of the causal factors. Experiences. So a very significant role experience plays in terms of determining whether you can be prone to GAD or not. So if you're often experiencing some kind of a situation that you don't want to face, so let's say you are often looking into a traffic situation where you don't want to drive, or you're often not completing your work and you have to encounter a teacher. So these are all anxiety evoking situations, and you're underprepared for an exam, but you have an exam the next day. So that could also be an experience which is slowly building anxiety in you, and if that is not being looked into and taken care of, it can definitely lead to generalized anxiety disorder. Okay. Comorbidity. So what are the different disorders that can coexist or be there along with GAD? There are a lot of disorders. Let's look at it one by one. So we have phobias, we have panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, depression, suicidal thoughts, substance abuse. So I want you to take a look at this because some of these disorders you would have noticed in the differential diagnosis as well. But please understand that those symptoms could be quite similar but not the same. And at the same time, because another disorder like this coexists with generalized anxiety disorder, sometimes it becomes difficult to differentiate the symptoms. So at that point in time, this will help us to understand that probably the individual is having two or more disorders occurring at the same time. So phobias or panic disorder are quite commonly seen along with generalized anxiety disorder. I quickly wanted to show you a glimpse of the difference between generalized anxiety and panic attacks. It's quite often confused, misused interchangeably. So please take a look at this. It's very different from a panic attack, and generalized anxiety or generalized anxiety disorder is quite different. Again, I'm re-emphasizing on the point that it can co-occur but not always. Okay, so this should be helping you in understanding what could be the major differences between the two. To summarize, we have seen all the important diagnostic criteria of generalized anxiety disorder. We have seen the causal factors, what are the different reasons why people develop GAD. We also took a look at the risk factors, comorbidity, which means what are the different disorders which are coexisting with GAD. And for us to build up a little bit on our knowledge and to wear our thinking caps, we have seen the differences between generalized anxiety and panic attacks. So with that, we come to an end of a session on generalized anxiety disorder. Thank you very much for listening patiently. I hope this session has enriched your knowledge further. Happy learning.